and welcome to Fitness Coaching with Lois. Today I have a wonderful guest with me today at Franklin Lakes Sport and Spine. This is Dr. Anthony Manzella, and
Hello.
if you're wondering why the Manzella sounds familiar, my maiden name is Manzella. So this is my brother, and so excited to have him on with me today for the first time ever, which is really exciting. So thank you for hosting us here.
Thanks for being here.
So we're talking today about exercise safety, and it's so important when you exercise with a trainer or without a trainer to be your own advocate, right?
Yeah, absolutely.
So when you're thinking about exercise, you want to be really safe and you want to feel really good when you exercise. So I know I use a stoplight method. Green, go; yellow, slow down; red, stop. What do you think about that as far as when you're exercising? Do you think that pain is good when you exercise, or should people just kind of go into discomfort? Like, what are your thoughts on that?
Well, in terms of exercise, you want, it should be a pain-free environment. It should be non-threatening. You should. There's a major difference between muscle discomfort based on the exercise versus actual pain. No, it's not no pain, no gain anymore. That's not recommended unless you want to get injured.
Yeah, so be really, really safe when you exercise. There's a lot of great tips out there. So we just want to make sure everybody can hear you. So just try to be a little bit louder. So what exercise-related injury are you seeing most often?
Well, we treat a lot of runners. So we see a lot of like shin splints, Achilles, tendinopathies. And then in the middle-aged population, we see a lot of knee injuries, lower back, neck. Those are kind of like the main injuries that we see here at the facility.
Wow, that's a lot of different things. Are you attributing those injuries to anything specific? Maybe you want to talk about runners as an example.
So for runners, especially if you're increasing the volume of training too quickly, or you're changing some sort of aspect about how you're running the surface to what you're running on. So it's either your body can't handle the load. So it's either you're increasing your training too fast, you're changing the surface to which you're running at. Maybe you're trying to change your technique, and then that attributes itself to some sort of either soft tissue or bone injury.
Right. So is there anything that people can do to, like, so obviously once they get injured and they get diagnosed, what's kind of the next step?
Well, I'll take that question kind of two ways. One from a prevention standpoint. Preventatively, we want to make sure that you're smart about how you're progressing your training. So if you have a goal of a 5K or a marathon, you want to be making sure that you're progressing that very gradually. And then the same goes in the gym. When you're going to the gym, in terms of the structure you're programming, you want to be strategic in what you're trying to accomplish. You shouldn't be following recipes on the internet from the next influencer about what programming you should utilize based on you. It's best to search out a good professional like yourself or one of your trainers or a physical therapist as a starting point when you're not educated on the things that you should be doing. So that they can customize the program specific to what your needs are and make getting injured much less likely.
Absolutely. And I think a lot of that goes along with listening to your body, right? I mean,
Yes.
If your body says, ouch, that hurts, or you're super, super like tired the next day, or you're really sore the next day, a ton of soreness is your body's recognition of too much. Am I right?
Yeah.
Okay.
So a little soreness is fine,
but
because
like over
you
the
did
top.
something.
Yeah.
But when you do a workout and you can't walk for a week or you can't walk for a few days, you did too much. You overloaded the system. So that's you're presenting a stress to your body that it's not designed to handle at that point. Therefore, you overstressed it, and you could be causing damage to your soft tissue and your joints. And that maybe you don't get injured in that moment, but if you do that repetitively and just have that pattern of working out, that over months and years you're going to really break down your body, and you're going to lead yourself to degenerative joint diseases and tendinopathies and things that you could have prevented if you were just a little bit smarter with how you programmed your your workouts.
Yeah, and being okay with saying no, or it's going too much. So if you're working with a professional that calls themselves a professional, but you're not quite sure if what they're telling you to do works for your body, it's okay to say no. It's okay to be like, yeah, you know what, that's not going to work for me today, or I'm really sore
I don't feel comfortable.
Yeah, I don't feel comfortable with this. Be your own advocate. I think that's one of my great takeaways.
Yeah. And know who you're working with, because you know, unfortunately, especially within the fitness field, there are professionals that take weekend courses, and then there are professionals that have bachelors of science in exercise physiology and then get certifications. So you really have to know who you're working with, what their education base is. They're not just someone that looks fit, but they understand, you know, human physiology and movement and things that they can really be smart about how they're handling you as their trainer.
Right. So when it comes to, we're talking to general population here, our audience, my audience, your audience. When it comes to exercise in general, can you give them like a major thing that they should be doing no matter when they're exercising? Is there anything like warm-up wise that you would recommend for them always to do? I mean, granted, I always say you have to warm up, you have to cool down.
Yeah.
Are there anything specifically? I mean, I have my own things, but I want to hear from you because you're the physical therapy expert. What kind of movements should people be doing before they start moving?
So it's a difficult question to answer because it's very individual.
Right.
Okay.
Right.
Because each person has, you know, different areas of restriction and tightness. You know, certain types of joint pain. So you first thing is to address whatever, whether you have tight calves that you need to, you know, use a foam roll and roll out a little bit, or do some active stretching of that area. But so to be specific, you want to stretch or kind of move, warm up the tissues that tend to be tighter on you individually, and then some sort of warm up to increase blood flow and circulation to the body without overstressing it too fast. So warm the core temperature up over 5-10 minutes before you dive into more of the specific work that you're doing that day.
Right. So more of like dynamic type of movements versus doing like held stretches, right?
Yeah. I mean, typically we'll do more of an active or dynamic type flexibility routine pre-activity, and then more of the sustained holds after activity, and it has to do with priming the nervous system. So before, if you're going to strength train, you're priming the nervous system to handle a dynamic load. So being able to go in and out of positions relatively quickly. So you want to stretch to a lesser degree similar to that activity. So you do more of dynamic, where you're moving in and out of the position that you're improving flexibility to, versus a sustained hold that you would do as maybe part of your recovery after the workout.
Yeah. I think people hear the word stretch and they're like, okay, I'm going to sit in this movement for 30 seconds. And they do that in the beginning of their exercise routine.
Yeah.
And they wonder, why they don't really necessarily feel that great.
Yeah, because they're not priming the system for the activity.
Yeah, so when he says stretching, he means like in and out, moving through the range of motion more than
so
a
like a
stretch.
slow, a slow elastic kind of bounce at their kind of end range of their position.
Right.
Cool.
Example. Can you give us one example? I know you just showed one.
We were talking about the calf. So if you were a wall and I had my hands against the wall.
Okay.
In a lunge position, my back leg, I'm stretching my back calf. So a dynamic stretch would be more going in and out of that position in different planes of motion. So I can go forward and back to stretch it in the sagittal plane. I can stretch forward and left and right to get frontal plane.
Oh, I like that one.
And then I can kind of wind it up in the transverse plane by twisting. All again at their end, towards their end range.
Good. So you're not like hanging out there. I love that. Those are awesome. Really good. Really, that's really good. So, you want to give anybody a takeaway, like one thing as far as like the cool down that they should be doing? How long should they be holding stretches at the end of their workout? Should they stretch?
Yeah. So I guess a general rule of thumb is to understand what you're doing. So if you're stretching an area, you should have a specific purpose in mind. So if you, if you stretch your hamstrings, but the length of your hamstring, unless you're a dancer, is above 90 degrees, like you don't necessarily have to be stretching your hamstring. So you want to zone in and be very specific and strategic with the areas that you have tissue stiffness. So you would be zoning in, I use the example of me having tight calf, so I would be working on my tight calf, or if you have tight hip flexor or quad, you want to zone specifically on that area. Or if you're working on a specific, so say I'm not going to necessarily work on that area if I did a whole upper body workout, I would zone into the area of focus for that workout.
Okay, awesome. Fantastic. So if you want to know more information about Franklin Lakes Sports and Spine, or come in and you need physical therapy perhaps and you live in the Franklin Lakes area, Dr. Anthony is fantastic. I've used him myself, and I'm not just saying that because he's my brother. I'm saying that because I've worked with him specifically on my back problems when I was pregnant. So that's a while ago, but yeah, but you're really awesome. So thank you so much for having us today. Thank you at home for watching, and have a great rest of your day. Bye, everybody.
Bye.